Hi, everyone. Thank you for joining us during our June Lunch and Learn. Our presenter from Safe Kids is talking to us about water safety today during National Safety Month.
Much. Great to be here with all of you. My name is Betsy Hartner, and I am an early childhood health and safety specialist with the Oregon Child Development Coalition. And part of my role in that position is as the state coordinator for Safe Kids Oregon. And for those of you who are not, Safe Kids Worldwide is an international organization that's dedicated to injury prevention for children. Unintentional injuries are the #1 killer of children, as many of you are probably aware. And so in every state, Safe Kids Worldwide has a state coordinator and then coalitions throughout the state. So we currently have 4 coalitions, Safe Kids coalitions, that are comprised of a variety of professional and community members within each region that we have active right now. So that includes Safe Kids Portland Metro. We have Safe Kids Washington County, Safe Kids Columbia Gorge, and also Safe Kids West Oregon. I know that Jessica participates in the Safe Kids Columbia Gorge meetings. And we've also had conversation about starting new coalitions, but I'll share that right now, Safe Kids Worldwide has paused creating new coalitions because they are revamping how they assess and what their expectations are. So we are waiting, but there is some interest there. So anyway, as the state coordinator of Safe Kids Oregon, it's very important to me that in my role, I'm able to do something that's impactful. And so when I was looking at, well, what are the, in terms of injury prevention, what are the initiatives that we have going on? Of course, motor vehicle injury is #1. In terms of cause of death, we have poisonings that are high up there. Firearms, I believe, is #2. And we have drowning. And drowning is consistently high on the scale of hospitalization and death for children in many states, but also including Oregon. And what we saw is there really was no coordinated effort. There are small efforts for organizing around drowning prevention, but nothing coordinated at the state level. So I decided to convene a water safety task force. We now have about 35, close to 40 members, and we've been meeting for just over a year. So I will share my screen and tell you a little bit more about the task force. Here. Okay. So here's the structure of the Water Safety Task Force. Initially, when we first started meeting, it was just one body of all the different people who had been part of that. And that includes Safe Kids Coalition members and coordinators, people working in American Medical Response, EMS services, people who work in Marine Patrol. We have river rescue members. We have Dr. Hoffman, who is the medical director of the Injury and Violence Prevention Program at Dornbecker. And he's also the chair of injury, violence, and poison prevention for the American Academy of Pediatrics. So he's been awesome to have on board. So we really just have a wide variety of folks from different fields who are coming together to share information and to create best practices. So we decided to create subcommittees, or what we call action groups, so that we could be more effective in our work and to pool together people who are specializing in certain areas. So we developed an education and outreach action group, a life jackets and kiosk action group, and also a policy and legislation action group. And then we also created a steering committee that can help, that are sort of like an executive team that can kind of help guide the overall course of the larger task force. And then because we care very much about equity, and we know that there are populations who are at greater risk. We created a DEI steering committee of experts in that field to help oversee the work and ensure that we're reaching all communities for all of our action groups. So the primary functions of the task force is that we meet quarterly. We were meeting monthly, but now that we've divided, we meet as a whole group on a quarterly basis, and we share information. We provide resources, educational materials, opportunities. We share what some best practices are. We share out about national and state level initiatives. And we provide an atmosphere and a space for people to communicate and to share with one another. And then we also have opportunities to present on different educational topics. So our steering committee, so I'm just going to share a little bit about each group. Our steering committee oversees most of the action group work. They help us with priorities. They provide advice around budgeting and any changes. They help with ensuring our agenda and priorities are aligned with diversity, equity, inclusion, and the principles and those principles. And we meet typically every 3 weeks and on an as needed basis. So here's just a few more. I'm not going to read all of these out loud, but one of the things that we have recently introduced is an equity inclusion lens guide. This is a really wonderful resource for any of you who are looking to prioritize DEI within your organization. It was created by the Nonprofit Association of Oregon, and the committee reviewed a variety of equity tools and lenses, and we selected this one because it has, it's like maybe 26 pages long, but what's really awesome is you can cater it to whatever you're working on. For example, they have an equity inclusion lens worksheet here that helps you keep in mind historically excluded groups and asks really good questions about how can you consider and make changes and ensure that you're doing what you can to include everybody in your community. This is also something that we introduced as we're a multidisciplinary group. This is a continuum on becoming an anti-racist, multicultural institution. It's for us to review, to take a look at our own agencies and where do we come from and where do we fall in terms of our individual agencies' readiness to do the work. So that's something that we just provide to members as a tool to understand where they may be on that continuum. And I'd be happy to share these with the group. So as I mentioned, we have action groups. We meet on a monthly basis or every few weeks. It kind of just depends. We've just decided to pause a couple of the action groups as now it's the summer season and folks are really out there. You know, we got our friends at the Marine Board. People are pretty busy right now. So we're going to pause for a few months, but come back in the fall to resume some of the projects, which I'll share with you. So as I mentioned, we share our work with the DEI steering committee, and we're developing work plans and strategies to prioritize what we think is important for each group. So for education and outreach, we want to take a look at what current water safety programs and initiatives are happening across Oregon. We are looking at developing messaging for water safety outreach and education programs. We want to support planning and promoting water safety competency, swim lessons, which many of you probably know are really hard to come by these days. That's a big concern that we have right now, is that there's a lot of kids that haven't had swim lessons because pools have been closed, mainly due to staff shortages. And we want to partner with educational systems, health systems, community groups, and agencies such as yourself to support whatever you're doing to provide comprehensive water safety education and access. And then develop a public information program. So creating recommendations and information for media groups to get the word out more broadly. So one of the things that we did within the last few months was we developed a list of community-based organizations. We decided to start with the Portland metro area, but we're looking at all the agencies that are serving communities that might not be served, but we know might have a higher risk. So we're starting with those who we have already an established partnership with, because relationship-based partnerships are so important. And how you do the work is really important. And so right now we're planning to look to host some focus groups where we learn qualitative data from community members about what their experiences are with water and with water safety education, etc. We also developed recommendations for a national media day, but that it happens around Oregon, on what topics are important to cover related to Oregon. So in Oregon, we know that people are drowning in natural water, much, much more than they're drowning in pools. We know that teen boys are at the greatest risk of drowning. But you actually see a lot of education and outreach marketed to very young kids, although they are not at greatest risk. So there's things like that. Also dangers of open water. And then we're recommending wearing a life jacket if you are on an inner tube, because we're seeing kids and adults drown on floaties. So our life jacket and kiosk action group, we are identifying what existing life jacket kiosks are around the state, which ones are active, which ones are not, and other distribution programs. We're looking at ways to cross-collaborate between agencies. We're developing a life jacket kiosk guide for Oregon. They've got one in Washington. So if you want to construct a life jacket kiosk guide, what's everything that you need to know, and what are the best practices there? We also really worked hard to develop recommendations. If you see in the middle of that kiosk is the message board. You'll see that it's dedicated to little kids. And so what we know is that, as I mentioned, teen boys are at greatest risk. So how can we change the imagery and the messaging to be suitable for all ages, including adults who can model life jacket wearing? So those are some of the things that we're working on as well. And we're looking at grants, partnerships, expanding programs that are existing, and helping to plan and oversee new kiosk construction. So there's a really cool map on OregonLive.com. If you just type in summer drownings map in Oregon, and it's currently working on getting updated. It'll show you where drownings have happened around the states, and you can identify hot spots. And that's something that we're taking a close look at. And if you click on each one, it actually will show you the details of the circumstance and how the person drowned, how old they were, their name, and any news article related to it. We're comparing that with where we know life jacket loaner stations are in Oregon. If you type in life jacket loaner station guide Oregon in Google, it'll pull up this Oregon State Marine Board map. And so what we've been doing is overlaying that. And one area that we've identified is Kelly Point Park in the Portland metro area has had a number of drownings, and there is no kiosk close by. So that's something that we're working on. And here's a few examples of different kiosks across the state. We did a pretty thorough review and provided recommendations on what we think are good and which ones we think maybe could use a little bit of an upgrade, and what that looks like, what kind of life jackets to have, etc. And then we have our legislation and policy action group, which is pretty exciting. We're planning to introduce legislation in the 2023 session. Dr. Hoffman, as I mentioned earlier, he has been successful in passing several pieces of legislation, including a crib bumper ban in Oregon, which are designed to protect children from unintentional injury. So this particular group is focused on using data to build a platform, evaluating the political climate, who is our supporters, who are our opposition, with the legislation we're introducing, which I'll share a little bit more about in a moment. We want to engage stakeholders, legislators, advocates, community leaders, develop new legislative proposals, and key strategies to influence decision maker, and then to create a legislative campaign action plan. So going on is a couple things. Right now, a child needs to wear a life jacket on the boat in the state of Oregon up to the age of 12. And as we mentioned, we know that teens are drowning in the greatest numbers. Right now, Louisiana is, they have the highest life jacket rate or age in the states, which is 16. So we would like to emulate their legislation and raise the age of required life jackets to through the age of 15. So that's something we'll be introducing. Another thing that we're going to be working on is float tubes are exempted from a personal flotation device, which is a life jacket. So I don't know if any of you remember, there was last summer a young girl and her father both drowned. She was on a floaty out in a river, did not have a life jacket. She started to experience, she was struggling, and her father swam out to go help her, and they both drowned. And so when you think of inner tube, there's a big inner tube culture in Oregon. There are a lot of people out floating on the river, and on a boat, they're required to wear a life jacket. On an inner tube, it's not required. So that's something that we would like to change, and to make children through also the age of 15 wear a life jacket if they are on a floating device. So that is it. I open it up to any questions if you guys like to know. I tried to go quick because I know I don't have a ton of time, but please let me know if anybody would like to know a little bit more information. And I should also say that our membership is open. If you personally are working in drowning prevention, or if you know somebody that is working in drowning prevention, please feel free to share my information with them. We are always looking for more folks to be part of our team and share their expertise.